So my topic for today is about food deserts. So the overview of all the points I'm going to be talking about include what a food desert is, how prevalent of an issue it is, who is affected by food deserts, and some demographics, and specific examples, the causes of food deserts, and the effect it has on communities. So what is a food desert? Basically, it's a geographic area or multiple areas with no access to healthy and affordable food. And grocery stores and restaurants are either too far away or way too expensive. And there's really no access to transportation, public transportation, or just any transportation, which doesn't arrive to your certain area, so you're not able to go places. And how prevalent is this issue? Well, 1 in 8 million Americans face food insecurity, and 13 million of them are children. So, from this, you can see there's a lot. And nearly 23.5 million people live in food deserts across the US. 20% of rural areas in America are food deserts, which shows you how many communities are affected by this problem. So, who is affected by food deserts? Well, we have children, which make up 6.8% of the US population, and adults, which is roughly around 6%. So what are the factors that affect people in food deserts? And here are a few. We have race and socioeconomics. So with race, the top race we have is African Americans. They suffer the most, according to one article. Around 8% of African Americans live in a census tract with a supermarket compared to 31% of whites, which shows that supermarkets are not really prevalent or are not found everywhere in the community compared to a community with whites. And then we have Native Americans. So another quote saying households of Native American families are 400% more likely than any other US household to report not having enough to eat, largely as a result of living in remote, isolated locations where food supplies and jobs are scarce. And then we have the Latinx community. And then that's 29% of Latinos that live in food deserts. So these are the top three races that struggle and are found in food deserts. And then you have the socioeconomic aspect. So more than 11.5 million Americans are low income in these food deserts. And there's no access to transportation, and they live in neighborhoods where transit's not available. So they're really at this disadvantage. So here's some demographics I'd like to show you. So on the left, we have a whole map of the US and the number of city residents living in food deserts. So we have anything greater than 10% would be the black areas. And then you have 5.1 to 10%, which is like more towards the East Coast and the South. And then you have anywhere from 2.5 to 5%, which is probably majority of America. So which is good to hear that not too many people in this country. There is still a large percentage. Places like Chicago and New York and the survey there. So anyway, the extent of food deserts. So in 2009, 2.3 million Americans lived more than 1 mile away from a supermarket and did not own a car. And that's equivalent to over 2% of all US households in 2009. So that just goes to show you some data, on how many people are actually suffering from this problem. And then there's a little pie chart about the Baltimore neighborhood food stores. And you have races, African American, mixed, white, and other. So as you can see, African Americans make up majority of this. This is 43%. And as you can see, white, it's only 4%. So you can see what kind of people are suffering from this problem. And then you have mixed, which is about 14%, and anyone other than these races, 39%. So then you have the proportion of carless households in DC. And you can see that, how areas are segregated and, there's certain areas where they're in food deserts. So, yeah. So one example I'd like to bring up is New Orleans, USA. So before Hurricane Katrina, there was abundance of grocery stores in many communities, and they were all within a short mile radius. Everyone was able to reach their local store, no problem at all. But after Hurricane Katrina, there were multiple businesses destroyed by the floods, and there are fewer businesses, which means there are not enough stores to support the communities. And these communities are low-income neighborhoods, right? With people of color, and because of this, there is lack of food options and lack of nutritional food. So now people are resorting to convenience stores with cheap, affordable food that's processed. So, what are some causes of food deserts? How did this come about? Well, we have economic inequality. So, many come from low income backgrounds, as I mentioned. And there really no change representatives from these communities made it out of recognition, and it's much more difficult to put in. And then systemic racism, which is a major playing factor. You have majority of communities in food deserts are communities of color, and because of systemic racism, they're hit the hardest. So these voices of communities are shunned, they're covered, and they're really not heard. And because of this, many cannot speak out. But again, their priorities are also to survive in such circumstances and just make it by day. So, how this goes specifically into redlining? So, redlining is an illegal practice. It's the act of refusing to provide financial services and other services to people of color based on where they live. So, examples: being denied a loan, living in a neighborhood with poor infrastructure, meaning, so these were just some examples that occurred. So, you have houses with no electricity and water. There were utilities that were not usable, lead poisoning in the water, rat infested spaces, and there was mold growing everywhere in some of these houses. And again, they're segregated. So, you also have poor segregated school systems. And although this illegal practice was banned nearly 50 years ago, its effects still play a major part in America. So, how does this correlate to food deserts? Well, redlining strategically placed communities of color in areas with poor housing, schools, and fewer stores. And also, it gradually worsened over time. So, food deserts are one example of the effects of redlining. After many years, the communities were still segregated by race and income. And the effects still suppress these communities by preventing them from having a better life for generations to come. It's basically embedded in our system. And it's really hard to eradicate it now since its effects, it's really hard. So the effects of food deserts. Well, in food deserts, healthy, nutritious food is not available since stores are located miles away. And the only stores in or near these communities are convenience stores. And in these convenience stores are really cheap processed foods, and they don't have any nutritional value whatsoever, as you can see in the right. These are some of the things you would normally find. And this has had severe, and I emphasize, severe effects on the health of communities in food deserts. So studies show, and this is one of the quotes I have found from a study, while the incidence of type 2 diabetes has risen across demographic lines in recent years, the greatest increases have occurred among Black and Brown communities. The highest rate of escalation has been identified in Native American youth and African Americans and Latinos of all age groups, with these groups suffering disproportionately higher rates of type 2 diabetes compared to whites. These are also groups most likely to live in food deserts, and researchers have established a strong correlation between food insecurity and increased diabetes rates. So people living in food deserts are at much higher risk for diabetes, obesity, high blood pressure, and cardiovascular diseases. So another demographic I'd like to show you, it basically gives an overview of the health effects. So people living in neighborhoods with the lowest availability of healthy food. So that's 55% that are less likely to have a good quality diet than people living in ones with greater availability. And then you have people living in neighborhoods with greater health food ability, and that was 45% reduced incidence of diabetes over a 5-year period. And then you have families moving to non-poor neighborhoods, and that resulted in significantly reduced body mass index, their BMI. And then when fruits and veggies were priced high, when they increased the prices for the fruits and veggies, there was greater increase in the children's weight over time. And $71 billion in healthcare costs due to chronic diseases could be saved with healthier eating. So that's basically the solution. So why is this important in today's world? Well, with COVID-19 putting stores out of business, it's even more detrimental to the communities in food deserts. Because businesses are so crucial for people in food deserts, and without them, so many people will be suffering even more. With stay-at-home orders, it's even more difficult for people to get groceries and for businesses to stay alive. Grocers have reduced their operating hours, public transportation has been reduced, and elders have been fearful of going outside and grabbing, the necessities. And unemployment has also struck these communities really hard. According to a CNN article, quote, in Louisiana, Mississippi, and Kentucky, the numbers of residents living in food insecure areas has spiked 43%, 36%, and 118% respectively, driven by the rise in unemployment, according to analysis. And then the article also mentions in Georgia, the number of residents now living in food insecure areas has jumped 69% since the beginning of the pandemic, according to data from Urban Footprint. So thank you very much for listening.